So Ezekiel, people have joined in pretty early. I think we'll start by introductions. I want to welcome each one of you to our Rise and Learn community of practice. Once again, it's always such a pleasure to have you all. It's December 2020. We are looking forward to wishing 2020 goodbye and looking forward to another fresh new year. This is going to be our last event this year, and really looking forward to listening to what Ezekiel has to share with us. Obviously, this 2020 has been defined in a lot of ways by the pandemic. Our ways of doing things have been redefined, and at the same time thinking about what solutions can we provide, even as we think about how we manage the challenges both at the workplace and even in our own homes. So thank you so much for being here. It's always a pleasure to host you. My name is Emily Kamundo Soro. I'm the director for Rise and Learn. I'm a HR professional and a leadership coach. I want to take this opportunity now to introduce the man on the screen, who is my good friend, Ezekiel Macharia. He's a chief actuary and the CEO of Kenbright. Of Kenbright International. If you could kindly mute yourself as you join in so that we can all listen to everybody. I'll just wait for you to settle down and then I'll do the introductions. All right. Good. So Ezekiel Macharia is a fellow of the Institute and Faculty of Actuaries in the UK and a fellow of the Actuarial Society of Kenya. He holds a bachelor's degree in actuarial science from the University of Nairobi. Ezekiel joined the financial services provider Kenbright Holdings Limited in 2016 as the CEO and chief actuary in charge of subsidiaries in Kenya, Uganda, Tanzania, and Rwanda. In his professional career, Ezekiel has over 13 years experience in the East African market, specializing in property and casualty, life and health insurance. He previously served in the Council of Actuarial Society of Kenya, task for 6 years, where he supported the development of actuarial and risk management skills in East Africa. Ezekiel is passionate about development of health financing in Kenya, and currently chairs the Health Working Party within Actuarial Society of Kenya. Under the leadership of Ezekiel, Kenbright is leading in the innovation of employee benefits provision through digitization in Kenya, where Kenbright has won various awards for MINT, which is Medical Fund Management Service, and a vehicle and an insurance motor aggregator. Kenbright recently partnered in 2019 with a UK-based company, Collinson, to introduce Smart Health in Kenya, an international medical insurance which covers COVID-19 and which also provides inpatient limits for up to 500 million people. So ladies and gentlemen, I'm very pleased to welcome Ezekiel Macharia today, who will be taking us through the COVID-19 fund, which is an employee benefits welfare initiative, and he will share with us a bit more about that. I'll stop sharing my screen, Ezekiel, so that you can take it away.
Thank you, Emily, and thank you, everybody. I trust everybody can see my screen. So today's session, we are talking about the COVID-19 Employee Welfare Fund. And the talk today, just to give an idea of what we're thinking about, is we'll be talking about employee productivity, because one of the things that people are ignoring is the impact of COVID on productivity. I know we are looking at the working from home aspect, but what is the impact of employees being unwell and them not working in the office as they should? And then we'll also look at innovation within the health sector. So we will introduce some of our partners who have actually been working on that sector. There's Tibu Health and Smart Applications. And then also we'll be asking ourselves on the issues of low COVID tests, why the COVID tests are low, what are the impact points for that? And then finally, we'll talk about how can you set up your own fund? How can you set up your own employee fund? So there are two options. You can do it yourself, or you can outsource it. So obviously we'll talk to you about you doing it yourself, And then the outsourcing piece can be done by us or other parties that you may want to work with. So that's really the topic of today. So I will now go to the next section, which is really now on employee productivity. So just to start off on employee productivity, one of the key things that as HR and also as an employer, your considerations are, one, if your staff is infected with COVID, and two, if one of the family members is infected. So if our staff is infected with COVID, some of the key things you need to look at is they'll be away from office. So you as an employer, some of the costs you're losing, the salaries you have to pay for them, the overhead costs that you're incurring that you need to take care of, and that is something that you will lose. Number two is some of the people might have severe to mild conditions, which might have additional health costs. And that's something that as an employer, you may have to take care of that bill, or you may need to look into other options. As you're aware, some insurers are not paying for COVID, some are. People like NHIF are not paying right now. Then a third item to look at as HR is the issue of key man risk. So what if your great director or your best salesperson dies? Okay, so that is something that you need to think about, and in terms of the risk that the COVID that will provide by COVID. And then also the fourth item is on productivity is one staff member infecting other staff members, and we'll talk about how that affects you as you move along. So we'll talk about how that affects you as you move along. Then the second item is the issue of family members. So if you might have employees working in the office, but what if one of the family members has COVID, there's a stress, mental wellness that you need to look into, how you need to take care of that, whether you need to set up a fund to take care of that cost. And also some of your employees who may be working from home, if they have a COVID patient in the house, they may not be able to take care of that, not be able to work at home. So maybe they need to come back to the office or an offsite position. So the next slide I will talk about is innovation within the service sector. In fact, before I go there, before I go there, I want to talk about key considerations you as a HR you need to think about. So the key considerations when you're looking at productivity is cost of staff to the company. So that's your salary, that's your employee benefits, and also overhead costs. The rent you're paying for where they're sitting, other costs that you attach to that stuff. So when an employee is unwell, that is the cost benefit analysis you have to do. You have to look at. If they are unwell, this is the money I'm losing, because you have to pay them a salary, you have your employee benefits, your pensions, you have your overhead costs, you have a space they sit in, you bought for them a computer. So treating them and making sure that they are okay, that is the cost. When you're doing cost benefit analysis, you have to look at those three components. So when you're looking at measuring COVID productivity, I think there's somebody on the line. Okay. Emily can mute the people who are not okay. And then also, so there's also that aspect of working from home or versus working from the office. So when you're looking at productivity, you have to look at which employees, what are the customer touch points, which employees need to engage with customers. Those are ones have to work in the office. People don't need to have customer touch points, have to work from home. Then the issues of securities of remote working and also monitoring tools. How do you monitor productivity of your employees? Now, as we will be talking about COVID today, the issue of energizing employees. If an employee has either they are unwell or they're sick, they will not be as energized or as productive as they usually are. So that issue of monitoring them, or you can look at treating them. So there's some employers who have taken the route of let's just do nothing. That can work for them, but for some, clearly that they need to look at whether they want to or see how they can manage that issue of stress at home or stress at work. So now I'll talk about new services in the market. So before last year, the issues of testing, whether it's blood tests or something, was not usually done. But we have new innovation providers now. We have Tibu Health who's doing this, and even E+, who are able to do the testing at home, and you're able to work with them, and others who are also coming up where you can work with them on that test. Then there's also the home-based care. I know we've all seen that hospitals are full, or some hospitals have only allocated a few beds to COVID. So the issue of home-based care is now a critical item that we need to look into that. And then finally, there's the issue of contactless identification, where people like smart application are creating the issues of one-time passwords. And not just at the hospital level, where we are looking at working with them on where you're doing home-based care. So actually identification can actually be done at home, where if somebody is being treated for COVID, they can actually have one-time passwords and contactless identification done at home. And so when we're talking about you doing this yourself, you can actually implement this, and we'll show you how you as HR, you can work on doing this yourself, or we can talk about how you can outsource this service. We have created solutions around it where you can come and we can see how that will work. So let's talk about another component is why are there low COVID rates? Why are there low test rates in the market? So as you know, we're all aware, Kenya in general has been relatively low in the testing statistics. And we've seen employees are avoiding testing. And one of the three key items, there are many reasons, but one of the three key reasons we've seen is the issue of costs. So especially when some insurers are not reimbursing if it's not a positive test. So if it's a negative test, you're not getting reimbursed. Some are afraid that maybe they don't have COVID, or they don't want to, incur that cost to test if they don't think that they will be reimbursed. So that's one of the key items. In fact, one of the main items where people are not doing tests. The second one is the inconvenience. Some people are not aware this home-based testing. So some are thinking that if I need a COVID test, I need to go to a hospital. I know some people are thinking there's COVID in the hospital, so they don't want to go there to begin with. And that is what really, that inconvenience is what is making people not want to go for the test. Obviously, now if the employer can tell them there's home-based testing, they can actually be a bit more comfortable. And finally, the stigma is that one, they may not know how you as an employer, you'll react when you know they have COVID. So obviously, if you have a COVID, when you have a COVID fund or a COVID policy, so that the employee can actually know that actually when I get COVID, this is the procedure, or this is what I need to do. So when you set up a fund, it also enables the employee to know that you'll actually support them in that journey of when they get COVID and how they'll move along. But the second issue is, what is the impact of these low test rates? So low test rates, and as you're aware, leads to high infection rates, because if you are not ring fencing people who are infectious, because we're not testing them, obviously that means that now you can have high infection rates. And you've seen right in Nairobi, with many employers, you've seen now people who have COVID are actually increasing in the office because of the low test rates. That's one of the key issues that is really affecting this. Then the second component we're looking at is the increased chance of developing mild to severe COVID conditions. So when somebody has pre-existing conditions, you're diabetic, or you have some of the conditions that COVID looks at, where it's a bit more severe, without testing and early intervention, that really can escalate. And that's something really that as an employer you should look at. The second point here under this section is that, remember, I keep mentioning the key man risk. If your best salesperson or your best technician dies, thinking about testing early and looking at people, especially with pre-existing conditions, whether you can flag them out and say, okay, people with pre-existing conditions, if you have any exposure to COVID, you need to have some testing done to manage. And obviously, lastly, reduce productivity, obviously, with high infections rate. I think we've already talked about that because of that. So now is when we talk about an employee welfare fund. So for an employee welfare fund, what we're really looking at is the purpose and the why. Okay. So what's the purpose of the fund? The purpose of the fund is to pay for testing. Testing can be easily set up, and we'll talk about how that can be done. And two, paying for home-based care, especially where beds are not available. And the why is because you want to protect your productivity. Remember, the more sick employees you have, employees have to go in quarantine, or maybe they may be
Ezekiel, I think we are losing you. Ezekiel?
Yep.
Yeah, I think we
You're
lost
back?
you for us. Minute, yeah, I can hear you.
Okay. Now we're back. Yeah. So the issue of protect productivity, I want to mention that, and that's what when we said measure productivity, we were talking about how much salary are you paying your employees, what are their overhead costs, what's your pension cost. So you need to create a test fund, because that is the productivity you're protecting. So you're putting cash to take care of that productivity that will be lose when employees are away from the office. And the second one is key man risk. And I really want to belabor this point, is that your key staff members who have pre-existing conditions have high exposure to mortality due to COVID. So having a solution around that, if you look at your company's profits, what will you need to do to ensure that the productivity is at par? So that's really the why. When you're looking at setting a COVID fund, you can do this yourself and talk about this. And we'll talk about. So the next slide, what I'll be talking about is how do you do it yourself. It's a very simple process, actually. Is that it's just 4 components: set cash, get a provider panel, and administrate the fund. So I'll just take you through it. So the first thing you need to do is you need to sit with the finance department and come up with a number. You may not have an actuary there, but at least you'll have some quick and dirty number you can come up with and say, let's set up maybe 50,000 or 100,000 as a COVID fund for testing. And remember, insurers only pay for tests if you're unwell, but here we're talking about tests in case just for testing, because we're looking at productivity protection in terms of what we need to do for our staff. So sit with your finance department and come up with a fund allocation that you want to set up. The number 2 is just selecting a panel of providers. You say, okay, we have all these providers who can do this work for us. And you sit with them and you negotiate terms with them. This is how much we'll charge, blah, blah, blah. And this is how the setup will be. Then finally, you need a way for staff to identify yourself at the provider. So you need to administrate it, which is 3 things. How do you identify this is one of your staff? How do they get treated on credit, which means they just go there, show up, get testing or home-based care or whatever they want to do, and then sort it out and then go home. If it's home-based care, somebody just comes to the house, comes with the odometers and the drugs and the things they need to come with, sort them out, and then go away. So they don't ask them for money. So when you say treatment on credit, it means that they do that whole thing. And then finally, settlement with the provider who you've negotiated with. So as a HR, you can actually do this. If maybe you have a few staff members, maybe you have 10, maybe you don't need to outsource this, you can actually do this. If you have maybe 100, 200 staff members, this might be too much work for you. You can look at outsourcing. And that's where we as Kenbright, Tibu, and Smart, we've come up with a solution around this, where we're looking at the outsourcing solution. So, and that's really where the purpose of the talk is about, is that how, if you were to outsource this, we actually have a solution around it. And the idea is that we as Kenbright, with Smart and Tibu, we're partnered, where we have a plug and play COVID-19 employee welfare fund at discounted rates. And the idea is it can be bespoke. You can add providers, you can see how much you use. We have also partnered with KCB, so the issues of interest rate can be sorted out so that the fund earns money as you're using it. And if there's nobody sick, you can also have your money back. So what does the structure do? So the structure is very simple. So we as Kenbright, we administrate the service, where we'll ensure that the whole service is running. Smart looks at member identification with the one-time password, the OTP solution, whether it's at the testing stage or the home-based care. And then Tibu, even the CEO is here, Jason will also, I'll also let him talk a bit, provides home-based testing and care at discounted rates, which they also have an app where members can actually come up and actually sign up and actually have that home-based care solution provided. So with that, I'll let Jason, who's the CEO for Tibu, also make some comments, And then also I'll let Smart just make some comments on how the solution works. And then now we'll take some questions from the members. So Jason.
Hi, thanks Ezekiel for that presentation. Yeah, so can you hear me? Yeah. So we're a concierge medical company. My background is in public health. Prior to founding Tibu, I was with the World Health Organization working on outbreaks and emergencies from Geneva for about 5 years. Basic gaps in the markets are waiting rooms. Hospitals take quite a long time. They're very, very expensive. So our solution is to bring the clinic, the doctor, and the lab to the patient wherever they are in Nairobi. So this is including COVID-19 testing as well. So the basic premise is COVID-19 test can be requested through our mobile application, which is available on Androids, or they can call our customer support line, send us an email at support@mmd.africa, and we deploy one of our healthcare workers to your location to carry out the COVID-19 testing at home, and results are returned the following day. Since the pandemic started, we've carried out over 5,000 investigations on clients throughout Nairobi, and we do work with some of the largest corporates as well. So we're one of the more trusted partners, if you will, with regards to COVID-19 testing. So if there's any questions, I'm happy to answer them regarding our model and the services we deliver. Otherwise, I suppose I would hand it over to our colleagues from SMART to equally introduce themselves. Over.
So someone from Smart, I don't know if the CEO is there, but if it's not, so that is really our presentation. I'm happy to take any questions. So the service really is, I think Harrison is joining. So the service really is to come, how can you do your own fund? You can do it yourself, as I said. You don't have to outsource it if you have few staff. But if you have many staff members, the solution here we're looking at is an employee welfare fund, to ensure that you protect your productivity, and also you look at protecting your key stuff. So Emily, I'll hand over back to you in case of any questions that the members might have. We're happy to ask.
Hi Ezekiel, how are you? My name is Mukunya. I have a question. In terms of the costings, what are the costings? Should we opt to move with the consortium that you have?
So thank you very much. So for us, so I said that I just want to keep back to the previous question. Is that what you need to do is just look at your population. How many people do you have? Maybe you have 100 people or 50, or say what do you want to do? You want to do testing only? So if it's testing only, the service that Jason has with Lancet is at 6,000 bob per test, and that's the current rate. And then for home-based care, it will be based on use. So it's you as an employer to say, we can only afford 100 tests, or we can afford 2 home-based cares, and maybe we set up 20,000 shillings on the side, and that is what we'll use until we deplete. Remember, these are funds, so it means it's you don't use it to get your cash back. And so that's really what this service is that you set up a fund, we enroll you, and then Jason and team actually go in and ensure that the service is provided. I hope that has answered your question.
You've answered about the home-based care and the testing. What about the full package, including also the interest rates for any funds that are not used from the drawdown?
Okay, so when funds are not used, so what we are using KCB as a custodian. So they credit their interest rates on a daily basis based on money market rates. So they'll work with 10%. The average rate now is about 10%. So that's what remember, they credit for every day that the fund is not used. And then it's like a pension scheme. So once you take the money in the fund, it's credited interest. Once you take your cash out, then you will be charged for taking the cash out, and then you will get your cash back. If you use the funds, then those funds will be used by Jason and team, and you'll get your statements from Smart telling you how much you spent on the fund. So that's really works. And we're happy to engage you and give materials on how the wordings on how it really works.
All right, thank you.
If I may jump in real quick here, if I may. The 6,000 shillings that Mr. Ezekiel mentioned, those are for small groups. We for this specific fund, if we're talking about 30 plus individuals, if there's a larger group of individuals that need to be tested, our prices come down to as low as 57.50. You know, we're currently the cheapest in the market with the highest level of service, if you will, which is on demand. And so all of our lab investigations are carried out by a Category F research level lab that has been accredited by KML TTB and the Ministry of Health to carry out COVID-19 testing. So the results that you receive are coming from PCR machines with 96 and 99% sensitivity and specificity, and they're also valid for travel as well. So most of our clients are travelers. So just thought I'd throw that in there real quick. Over.
Thank you, Jason. Do we have any other questions or comments from the team? You can unmute yourself or also type it on the chat box. So maybe Ezekiel, if I can ask as I wait for another one. So what's the refund? Say I put in, for argument's sake, I put in 100,000 and nobody uses it. How much refund do I get and after how long?
So the refund obviously is 100%. So if nobody uses fund is, as I said, you can actually do it yourself. You can set these funds up yourself in your own company and do it. If you want to outsource, obviously, if there's no usage, obviously that fund will earn an interest. So you just get back your fund. So because what you realize that these benefits are not insurable, so the only option you're left with is fund management, especially for testing where there is no condition or testing where somebody doesn't have symptoms. That's really something that we are seeing as a gap in the market that we want the market to provide.
Thank you. Any others?
I have a question related to what he has explained. I just wanted to find out how long the refund period takes when somebody launches in if they have not utilized the fund. And secondly, are you collaborating or partnering with other major insurance companies like UAP who are also offering COVID-19 treatment for people who want that?
Thank you very much. So
Yeah.
thank you very much for that, Banis. I remember this solution on refunds is based on the bank, how fast it will be. I'm assuming it will be within 3 days, you'll get your refund back. But this fund is supposed to cater for gaps where the insurer is not taking care of that bill. So let me give you an example. If you do a test right now and it's negative, the insurer will not reimburse you as an employer, right? So if you say you want to test your employees for OSHA, you want to test 50 employees for OSHA, that cost is not going to be reimbursed by an insurer. Okay, so the idea of a fund is to take care of exclusions, take care of costs that the insurer will not take care of. Okay, so that is where we're really coming in because there's a gap there. It's, you know, where if testing is done and there's no, there's no positivity or where there are no conditions. So that's really where it's complementary to the insurance service. It's not duplicating the insurance service because if the insurer pays, then obviously the fund doesn't need to pay. The fund is supposed to pay for expenses that are not covered.
Thank you. And so far, what is your coverage within Kenya?
Sorry, what's that?
What's your coverage or what is the size of the clients that you already are serving at the moment?
So the fund itself is a new service, but Jason has been doing testing in Nairobi. Jason, maybe you can comment because we are starting with Jason as a key provider, but we're happy to onboard other providers. So Jason, maybe you can comment on thing you've done and what is your reach.
Certainly. So we've been in the market for since March. So essentially since COVID-19 first landed in Kenya. Since then, we're focused in Nairobi to answer your question specifically. So the greater Nairobi area. So we will go out all the way to Athi River, Kahawa West, Vuaka, and these places. but we haven't yet gone out past those areas. As I mentioned earlier, we've provided services to over 5,000 clients. We're the provider of choice for Knight Frank. We've done work for NCBA, the Jaguar Group. I mean, the list goes on. I'm happy to share a list of some of our clients and provide you with some contacts if you'd like to make references. We're very, very confident in the quality of our services. Over.
Yeah. Thank you.
Yeah, thank you, Bani. So just to identify is that, remember, the idea is you have the fund that you'll be setting up, and then you have the provider who will be doing the fund. So remember, we only have the service right now in Nairobi, but if we identify other providers who have good quality service, we are happy to onboard them for you, who will be providing that service in those other markets that you have staff located.
Just remembered something. What about people who are not like corporates, people who want to join us individuals? Do you also cater for that?
Yes, so the idea is, yes, you can obviously cater for that, but the idea is, how many tests? So you just come up, and I said, come up with a plan. You want to test for 10 people, so you now set up the fund ready, and then the fund is available. Tell the people, sign up these people under the smart, so we will put them with OTP. Now they'll know they can get a test. So they can walk in or call Tibu on the phone or on the app, then they go to the house, they get tested, and then the results come back to them. So the idea is to actually just make it a bit more convenient to anybody who might want to provide testing on credit, COVID-19 testing on credit, to ensure that the employees don't feel that they need to get on their pocket for them to get COVID testing. So yes, it's open to corporates and also individuals, because it's a fund, it's not insurance, so it's use-based. So it's a use-based solution. What is the cost per test? I've seen Mary ask. Jason mentioned that for more than 30 people, the cost is 5,700 per test. Yes. We're happy to share you the price schedule for each test based on the population size.
Then Ezekiel, I have another question. Mukunya here again. My question is, have you negotiated rates with hospitals, especially for admissions and etc.?
So remember, here we are not taking care of COVID tests at the hospital. Here we're talking about home-based care and testing. So if this solution is only for home-based care solution, where Tibu can actually come to your house and resolve the COVID issues in your house, and testing, whether it's in the office or at home. So this solution is more for the home-based approach as opposed to the hospital approach. Why we don't want to go that route is because the hospital cost is much, much larger. So here we want to start with small amounts. Maybe people put 100K, 200K. They start the process, and then now we can escalate it to maybe now hospital levels, which can be, fund managing inpatient can be expensive. So I would be careful there. If as an employer to give that commitment. At least with home-based care, it's more of what Tibu will go with, the testing, the odometers, the drugs, which they're predictable, and you're able to price and say, okay, for a home-based care package, maybe 50K would be sufficient per person, and maybe you put for 2 people or 3 people. But now to talk about inpatient, I think as an employer, that's something you need to look into. I think insurance would be a better route for that. But this would be more of the testing and the home-based care. But we're happy to enhance it if you want to.
All right, thank you for the clarification. Appreciate it.
Yeah. So maybe also as people are commenting, also I'd like people to also give commentary on whether they found this as a gap in their own companies, or because we might be solving a solution that you've already solved. So also maybe you can also give us commentary on how you've addressed the issue of employees not really testing themselves, or how you're managing that. So happy to get that on the chat if you have any thoughts on that.
Maybe I can say something. Yeah, my name is Nicholas Wanambisi. I work for Crown Paints. COVID-19, as Ezekiel presented a complex thing, and we want to protect productivity. We want to protect our key human capital and so forth. But the pattern of testing is very interesting. It is very unpredictable. An employee tests positive. He or she can't afford the test, so the employer decides to test the employee. Then you discover that the employee stays in the house with the husband, with 3 children who are not her own children, three children, maybe they are orphans, with the mother, with the, relatives, African socialism. Now, this is not like a normal medical cover where the illness is not infectious. So you cannot test the employee alone, give her home-based care alone, because you want her to come or him to come back to work as soon as possible. So these are the experiences I have had in my company. You have to go out of your way to test all the people in the household, so that they can separate the negatives from the positives and be able to manage even home-based care program like this one, be able to manage them at home, so that when she finally tests negative or he finally tests negative and comes back to work, you are assured that the home environment is safe. So how do you incorporate such in this kind of fund? Because if you are putting the members on a smart arrangement, identification, and yet some of the people to be tested cannot be determined in advance. You have to make decisions as situations unfold, and make decisions on case by case basis. So if I have a fund, let's say I put in 1 million Kenya shillings or 2 million Kenya shillings for this purpose, how do I handle such situations? Or how does that is actually my question.
So Nicholas, thank you very much. Remember, this is a fund. So as a fund, this is not insurance, this is a fund. So with a fund, you control what you want to do. So if you want to say we want to test employee plus family, or we want to do home-based care plus family, we will assist you to calculate what that cost will be. Obviously, be much larger, because ideally for each test, we'll be multiplying it by the family size. So if there's a suspected case in a household, the average household is member plus 3, member plus 4. So automatically your cost will go up by 3 to 4 times. But it's up to you as an employer to see what you want to do. But it's your fund. It's your fund. So you determine what will you need to protect your own productivity. Can you sacrifice your employees to stay at home with COVID, with their families, or just test for them? Then you decide what that will be. Because for us, the solution is Jason just needs to go to their family and just needs to know on the identification area with the smart and the one-time password, who has the one-time password for testing or for home-based care. And once they get that approval, Tibu will now go in and they will ensure that whoever needs to be resolved in terms of home-based care testing is sorted out. So I would say it's more of the employer to decide how they want to structure it in terms of funding, and then see how that will work. We're happy to assist you to come up with a number just to start off, and then we see how that number moves.
And I think that's a good point, Nicholas, you raise, and thank you, Ezekiel, for the response. What I would say is that from a good practice, I think it would be great to incorporate, the household, just like the way we would for a normal medical benefit.
Yeah. So but I just want to mention it can be quite expensive, obviously, but if you can afford it, obviously that's something you can look into. Yes, but remember, member identification is done by smart through one-time password. So whoever has their one-time passwords for the care, as long as they send that to the Tibu team who will be on the ground at their house, then they will get that treatment. So Nicholas, it's very easy to execute it. It's just you to say which route you want to go.
Okay, thank you.
Yeah.
Maybe I can go for a question. My name is Maina.
Yep.
Probably this going to Jason. Now, especially for the team that is a bit vulnerable, likely to have escalated symptoms from COVID. How fast are you giving the test results? I have been following up a string of communication somewhere, and I noted some hospital are actually opting to do different tests, not necessarily COVID tests, because of the time it's taking. And if you look for someone you highly suspect they got exposed, they are vulnerable, within the normal time people are giving, the turnaround of 48 hours or to 72 hours, it can really escalate. So I don't know how fast you're doing that.
Okay, so before
great.
Jason answers, we've actually been thinking about a form of a VIP testing, because remember, we're also selling this service to travel agents who might want to have COVID done before. So there's some people who might want to travel within 24 hours or within a certain period. So I'll let Jason answer that question of if we can have an accelerated option where this is marked as an urgent item, and then that service will be provided, obviously for a small fee because you need to pay the labs. But Jason, I'll let you answer that.
Yeah, thank you. Great question. The short of it is yes. So we have our results are returned in general in the next day, so in 24 hours. We do have an express service where it's same day, so it's 12 hours. We're currently the only ones that are offering the same day 12 TAT turnaround time. And that's possible because of our relationship that we have with the lab. So if there is an urgent situation, we can come in 8 a.m. and we'll have the results back by 6, 7, 8 p.m. That very same day. So with regards to the different testing, I think that was a second part of the question. There's only one method of testing that's currently been approved by KMLTTB and the MOH, and that's PCR testing. Now, I have heard of some hospitals who I will not name that are doing antigen testing. And to be very, very clear, this has not been approved by the Ministry of Health. The protocols around this for treatment and follow-up have not been fleshed out yet. And so the hospitals that are doing this are, for lack of a better word...
Jason, I think we're losing you. But yeah.
Hello? Can we hear me now?
Oh yeah.
Hello?
Yeah, better now.
Where did you lose me, if I may? So I can...
Maybe I could hear you.
Okay, so what I was the second point that I was mentioning was with regards to the testing. Okay, there's only PCR. Go ahead, Ezekiel.
Yeah, sorry. So Anthony, just to answer your question, is that yes, it can be fast track, but for a small fee, we'll also give you that rate card. I think it's 500 bob extra. I'll confirm what the number is. But yes, it can be a fast track solution. Remember, this is a home-based solution. So once as the test is done, the member or the employer can decide, or the family can decide which other route they can take as the test is being resolved. So this is more of a solution to enhance or make it easy for them to get tested for COVID, but it doesn't stop them from doing other things, whether it's being admitted or other things going to happen. So Banis, you asked, do you also sensitize families or provide some education on COVID-19 prevention within the family? We don't do that, but we can think about it where we can see whether that can be a service. Obviously, be a time-based service, so we can have a side chat on that, Banis, and see what we can do for you. Lisbeth, you're asking, does TIBU issue certificates of the testing to the individual, or just an email, especially if you have an employer for airline or travel? Ideally, we would want that to be provided to the employee, but if you want sent to you as an employer, we are happy to send it. But ideally, it should be sent to the employee. But I'll let Jason comment on any data privacy issues that he may have as a company.
Thanks, Ezekiel. The short answer of this is yes, we do issue certificates, and they are valid and recognized for travel by both the airlines, member states, and the government of Kenya. With regards to the sharing of results, so when we're testing groups, we obtain consent while on site. Consent basically says, yes, I agree to share the results with my employer. We then follow up and we send the results to both the employer and the patient. We send digital copies, and for positive results, we call the client or the patient, we counsel them, and then we also provide them with a how-to guide on how to self-isolate, how to manage yourself and your family at home, et cetera, to really help them manage that continuum of disease, so to speak, until they get better. Over.
Emily, it's as of the test date. So the date you are tested is the date that it's valid for. So depending on what you're using it for most people, the day you're tested is when the certificate, it means you're negative on that day. It doesn't mean you'll be negative the next day. So that's really it. Any more questions?
Yeah, I think one more. Thank you for that clarification on the testing. Now, in terms of for the individuals who may not come from any company, what is the time for Tibu to get them on platform and get them tested? Someone today thought I need a package and want to get tested later.
Yeah, so remember, once we onboard you on the plan and you're already inside and Smart has enrolled you, that should take a day. Then once you get those one-time passwords, then the thing works. So whoever now you need to send those to enroll them, they'll have the one-time passwords. They'll now be able to get the testing or the home-based care on demand, as long as your fund takes care of that cost. So that's really it. So it's a one-day solution that can be done within a day. And once the person gets the one-time passwords, they can get home-based care or just normal testing on demand or at home or wherever they are within Nairobi for now.
All right, thank you.
Hello, I'm not sure whether I missed this. You've talked about the cost for the various services. Did you say anything about the cost for managing that fund? Because I believe the consortium you've put together is managing the fund and managing the testing and the home-based care.
Yes, thank you very much. So the cost we're going to put right now is based on usage. So it will be 10% of the claim value. That will be the cost for everything else. So the admin cost is 10% of the claim value. But the larger the fund, if you have a large fund, that can go down to 7.5% of the admin fee in terms per claim. So if there's no claim, there's no cost. But if there's a claim, the cost of administration will be 10%. But we will send you materials to the policy documents and all those contracts that you can look at, and we can have that conversation with you. So what we've also noticed that if you have, if the interest rates are good, you can actually balance off the cost of the fund to that admin fee to ensure that we are trying to manage to ensure that if there's interest on the fund with the KCB account we were setting up, that will enable to knock off the admin cost on the fund. So that's something we're looking into.
Great questions. Do we have more? We have about 8 minutes before we come to the end. So I just want to make sure I don't lock you out.
Okay, and so as we wait for the last question, I also want to mention that you can also replicate this solution in your own office, especially if you have a small group. Maybe the only thing you don't have is the discounted rates that we're able to negotiate for the bulk, because people like Jason, you come and tell them we'll get many funds for many employers and we will to negotiate. But you can implement such a solution. Maybe the only party now here maybe you might have is the smart OTP issue that you may need to have, but it's implementable. All you need to do is just identify where your people are, where the home-based care solution you want, and then you can see how you can implement it. But the key thing is, will your CEO or will your CFO agree? I think the argument here would be the productivity lost. We mentioned that in the slides. And also the key man risk, the risk of losing your key employees, especially the ones with chronics. if they're hit with the COVID, it's a very dangerous scenario. So that's really would be the first point that you need to think about with your CEO. Do we need to have a fund? Do we need to protect our productivity? And once we have that resolved, then the implementation, you can agree to outsource it yourself, or you can do it yourself, or you can look at outsourcing. But that's really a solution that we're looking to manage the gap in the market. So over to you, Emily.
All right. Well, thank you so much, Ezekiel. That was quite a great session. I love the engagement. Thank you so much for your questions. I think this is a great innovative solution that we all need. We obviously are hoping that things will get better and the pandemic will be slowly managed. But in the meantime, it's always good to think about the element of how do we keep our employees protected? How do we show that we are responsible employers, that we can still accommodate to provide some of these solutions for them? And at the same time, just keeping safe, just being able to manage our costs as well as we do that. So I like the element of having a fund that is only it's only going to be you only charge interest on it, for example, if you utilize and I like the balancing act of being able to invest the money somewhere. And obviously if it's not utilized, the employer can get the money back. But I think at the end of the day, I think the intent of the solution is what is for me is the biggest winner here. So I guess you have the materials sent to you later on. We will post them as soon as we receive them from Ezekiel. We'll post them on the online community. You can download them from there, and obviously their contacts will also be there for Jason and the team, so that you can reach them directly should you need more information from them. Do you want to say a last remarks, Jason and Ezekiel?
Yes, Emily, thank you. So for us, we are keen on working, also customizing it to each HR. Don't be ashamed, even a fund of 5,000 is enough. It's a good start. It's one test. What we want to do is really fill that gap. So we're really excited to see who we can talk to and just see how we can start this process. If you have your own bank, we also have a solution where we can work with your own bank, but there'll be a small fee because of the bank charges that they'll provide. But also if you want to work with your own bank and your own interest rates, we can also work on that. But you're happy to engage. We'll send Emily our contacts, and we're happy for you to talk to us. So over to you, Jason.
Yeah, thanks for that. And it was a real pleasure to meet everyone. We do look forward to engaging with everyone more closely about, healthcare innovations in 2020 and 2021. So appreciate everyone's time, and we look forward to hearing from you soon. Thank you.
Thanks very much. Once again, the recording will be shared, and the presentation, I believe, Ezekiel, the material will be in one location. Feel free to reach out to us should you have any questions. Thank you so much. You can unmute yourself and say goodbye. Have a great weekend.
Bye.
Have a great weekend. Thank you.
Bye.
Bye, everybody.
Bye.